E. coli unveiled symptoms, causes, and management. Imagine this. A seemingly ordinary day transforms into a nightmarish ordeal of stomach cramps, diarrhea, and incessant nausea. You wake up feeling fine, but as the day progresses, you start to feel a gnawing pain in your stomach. Soon the cramps become unbearable and you find yourself rushing to the bathroom more times than you can count. The nausea hits you like a wave, making it impossible to keep any food down. This is not just a case of a bad meal, it could be something far more sinister. These symptoms, while common to various ailments, could signal an infection by a microscopic culprit lurking in your last meal, Escherichia coli, commonly known as E. coli. This bacterium is often found in contaminated food and water, and it can wreak havoc on your digestive system. E. coli is not just one type of bacteria. It encompasses a diverse group of strains, some of which are harmless, while others can cause severe illness. The most notorious strain, E. coli O157H7, is particularly dangerous and can lead to serious complications, including kidney failure. This essay delves into the world of E. coli, exploring its symptoms, causes, and management. We will take a closer look at how this bacterium operates, how it spreads, and what you can do to protect yourself and your loved ones. Understanding E. coli is crucial, especially in a world where foodborne illnesses are becoming increasingly common. By the end of this essay, you will have a comprehensive understanding of E. coli, from its biology to its impact on human health. Through real-life examples and expert insights, we aim to empower you with the knowledge to recognize, prevent, and handle E. coli infections effectively. We will hear from medical experts who have dedicated their careers to studying this bacterium, and we will learn about the latest research and advancements in the field. Additionally, we will provide practical tips on how to prevent E. coli infections, such as proper food handling and hygiene practices. By staying informed and vigilant, you can reduce your risk of falling victim to this potentially dangerous bacterium. So, let's embark on this journey together and uncover the mysteries of E. coli. Understanding E. coli, short for Escherichia coli, is a type of bacterium that resides naturally in the intestines of humans and animals. This bacterium is a normal part of the gut flora, playing a crucial role in maintaining the health of the digestive system. It helps in the production of vitamin K and the absorption of other essential nutrients. However, not all E. coli strains are beneficial. While most strains of E. coli are harmless and even beneficial, some are pathogenic, meaning they can cause disease. These harmful strains can lead to a variety of health issues, ranging from mild gastrointestinal discomfort to severe life-threatening conditions. The pathogenic strains are often transmitted through contaminated food or water, making food safety a significant concern. One of the most notorious pathogenic strains is E. coli O157H7. This particular strain can cause severe illness, including bloody diarrhea, kidney failure, and even death. It is especially dangerous for young children, the elderly, and individuals with weakened immune systems. The symptoms of an E. coli O157H7 infection can appear within a few days of exposure and can escalate rapidly. The concern over E. coli stems from its ability to cause widespread outbreaks. These outbreaks can occur in various settings, such as restaurants, schools, and community events, where food handling practices may not be stringent. Health officials often have to act quickly to identify the source of contamination and implement measures to prevent further spread. Public awareness and education about proper food handling and hygiene practices are essential in mitigating the risks associated with E. coli. Understanding the different types of E. coli is crucial for identifying and managing the risks associated with this bacterium. Researchers are continually studying the various strains to develop better diagnostic tools, treatments, and preventive measures. Advances in genetic sequencing have allowed scientists to identify specific markers that distinguish pathogenic strains from harmless ones. This knowledge is vital for developing targeted interventions and improving public health outcomes. By staying informed and vigilant, we can better protect ourselves and our communities from the potential dangers posed by E. coli. Symptoms of E. coli infection. The symptoms of an E. coli infection can range from mild to severe. This variability can make it challenging to diagnose the infection early, as the initial signs might be mistaken for other common illnesses. Typically, they include diarrhea, which is often bloody, severe stomach cramps, and vomiting. These symptoms can be quite distressing and may lead to dehydration if not managed properly. Fever is generally low-grade if present. However, in some cases, individuals might not experience a fever at all, which can further complicate the diagnosis. The severity of symptoms can vary significantly from one person to another, influenced by the strain of E. coli and the individual's overall health. For instance, young children, the elderly, and those with weakened immune systems are more likely to experience severe symptoms. Symptoms usually start 3 to 4 days after exposure to the bacteria, but this can range from 1 to 10 days. This incubation period can make it difficult to pinpoint the exact source of the infection, especially if multiple potential exposures have occurred. If you suspect you have an E. coli infection, it is crucial to seek medical advice promptly. Early diagnosis and treatment can help manage the symptoms and prevent complications. Staying hydrated is particularly important, as diarrhea and vomiting can lead to significant fluid loss. Drinking plenty of fluids, such as water and oral rehydration solutions, can help maintain hydration levels. Over-the-counter medications may provide some relief from symptoms, but it is essential to consult with a healthcare professional before taking any medication, as some treatments might not be suitable for E. coli infections. In severe cases, hospitalization may be required. Patients might need intravenous fluids to combat dehydration and other supportive treatments to manage symptoms. One of the most serious complications of an E. coli infection is hemolytic uremic syndrome, HUS, which can lead to kidney failure. This condition is more common in children and the elderly and requires immediate medical attention. Preventing E. coli infections involves practicing good hygiene and food safety measures. This includes thoroughly washing hands, especially after using the bathroom and before handling food, cooking meat to safe temperatures, and avoiding unpasteurized dairy products and juices. Public health awareness and educational campaigns play a vital role in reducing the incidence of E. coli infections. By educating communities about the risks and preventive measures, we can help protect vulnerable populations and reduce the spread of this potentially dangerous bacteria. Hearing personal experiences and patient stories can also provide valuable insights into the impact of E. coli infections. These narratives highlight the importance of early detection, proper treatment, and the emotional and physical challenges faced during recovery. Ongoing research and scientific studies are crucial in developing new treatments and preventive strategies for E. coli infections. Advances in medical science continue to improve our understanding of this bacteria and how to combat it effectively. Community support and access to healthcare resources are essential for those affected by E. coli infections. Patient advocacy groups can provide support, information, and resources to help individuals and families navigate the challenges of this illness. In summary, E. coli infections can range from mild to severe, with symptoms such as bloody diarrhea, severe stomach cramps, vomiting, and low-grade fever. The severity of symptoms varies based on the strain of E. coli and the individual's health. Early medical consultation, proper hydration, and preventive measures are key to managing and reducing the risk of E. coli infections. Stay informed, practice good hygiene, and seek medical advice if you suspect an infection. High-risk groups. Certain populations are particularly vulnerable to severe E. coli infections. These include young children, the elderly, and individuals with weakened immune systems. Their bodies are less capable of fighting off the aggressive strains of E. coli, making them more susceptible to severe complications. Understanding these risk factors is essential for protecting those most vulnerable to infection. E. coli is primarily transmitted through contaminated food or water. Undercooked ground beef, unpasteurized milk, and fresh produce are common vehicles for the bacteria. Person-to-person contact in families and care facilities can also spread the infection. Several notable outbreaks, such as the one linked to spinach in 2006, highlight the importance of vigilance in food processing and handling. Preventing E. coli infections centers on maintaining excellent hygiene and food safety practices. Washing hands regularly, especially before meals and after using the restroom, is crucial. Cooking meat to recommended temperatures and avoiding raw milk products can significantly reduce risk. Ensuring clean and safe water supply is also vital, as contaminated water is a common source of E. coli. Diagnosing an E. coli infection involves stool tests to detect the presence of the bacteria. Healthcare providers play a crucial role in managing the infection by advising the appropriate tests and interpreting results accurately. Awareness of the symptoms and early consultation with a healthcare provider can lead to timely diagnosis and treatment. Treatment for E. coli infections generally focuses on hydration and symptom relief. Severe cases may require hospitalization and intravenous fluids. Antibiotics are not always recommended, as they can sometimes worsen the condition. Knowing when to seek medical help is crucial, especially for those in high-risk groups. For mild cases, home care is a viable option. Staying hydrated is essential. Avoiding certain foods and drinks that can irritate the stomach, such as dairy, caffeine, and spicy foods, is also recommended. Consulting a doctor becomes necessary if symptoms persist or worsen. In severe cases, E. coli infections can lead to life-threatening conditions like hemolytic uremic syndrome, or HUS, which can cause kidney failure. Awareness of these complications can aid in seeking prompt medical care, potentially preventing long-term health issues. In 2018, an E. coli outbreak linked to romaine lettuce affected numerous people across several states. The source was eventually traced to contaminated irrigation water. This case study sheds light on the importance of stringent safety measures in food production and the role of quick response in preventing widespread illness. Public health organizations monitor and manage E. coli outbreaks. They also conduct educational campaigns to inform the public about preventing infections. Their role is pivotal in outbreak response and in implementing policies to prevent future incidents. E. coli naturally exists in the environment, particularly in the intestines of healthy animals. However, environmental factors like improper waste disposal can lead to contamination of water sources, promoting outbreaks. Understanding the environmental persistence of E. coli is crucial. Recent technological advancements have improved the detection and prevention of E. coli outbreaks. Innovations in food safety technology, like rapid testing kits and better sanitation practices, are making food consumption safer. The future of managing E. coli lies in the continued development and application of these technologies. This essay has explored the critical aspects of E. coli, from its symptoms and causes to the measures for managing and preventing infection. By staying informed and vigilant, individuals and communities can significantly reduce the risk of E. coli infections. Continued education and adherence to safety practices are our best defenses against this ever-present bacterium. Let's empower ourselves to make informed decisions about our health and safety. Pause 3S. As we look towards the future, the fight against E. coli is far from over. Researchers around the globe are tirelessly working to better understand this bacterium and develop innovative solutions to combat its effects. Advances in genetic engineering, for instance, are paving the way for more effective treatments and vaccines. Scientists are also exploring the use of artificial intelligence to predict and prevent outbreaks before they occur. Additionally, public health policies are evolving with a greater emphasis on global collaboration and data sharing. By pooling resources and expertise, countries can respond more swiftly and effectively to E. coli threats. It's an exciting time in the field of microbiology, and the future holds promise for new breakthroughs that could one day make E. coli infections a thing of the past. Together, through continued research and innovation, we can build a safer, healthier world for everyone. Thank you for joining us on this journey through the world of E. coli. Stay informed, stay safe, and stay empowered. Pause 3S. As we conclude our journey through the world of E. coli, it's important to remember that the fight against this bacterium is not just in the hands of scientists and public health officials. Each one of us has a role to play in preventing the spread of E. coli and protecting our communities. Start by practicing good hygiene, such as washing your hands thoroughly with soap and water, especially after using the restroom and before handling food. Make sure to cook meat to the recommended temperatures and wash fruits and vegetables under running water. Avoid cross-contamination by using separate cutting boards for raw meat and other foods. Stay informed about food recalls and outbreaks by following updates from reliable sources like the Centers for Disease Control and Prevention (CDC) and the World Health Organization (WHO). If you suspect you have an E. coli infection, seek medical attention promptly and avoid preparing food for others until you are cleared by a healthcare professional. Educate your family and friends about the risks and prevention methods associated with E. coli. By spreading awareness, you contribute to a more informed and vigilant community. Remember, change starts with you. By taking these simple yet effective steps, you can help reduce the spread of E. coli and protect the health of those around you. Together, we can make a difference. Thank you for being a part of this important conversation. Stay informed, stay safe, and stay proactive. Pause 3S. This is another new chapter added to extend the video duration. The content of this chapter will be provided by the user.